Thank you, Monica. Our next presentation coming from India, and Usha, this will be done by the Usha Radhakrishnan, and the topic is Women's Insight into Obstacle in Cervical Cancer Screening, Experience from Family Planning Association of India. Usha is currently the Director of Monitoring Evaluation at the Family Planning Association of India, Mumbai, and she is having more than 22 years of experience in social and public health data management, research and monitoring and evaluation. She has played a pivotal role in various research projects and large-scale surveys, including the National Family Health Survey 3, collaborating with esteemed institutions such as International Institute for Population Sciences and the Tata Institute of Social Sciences. It is over to you, Usha.
First of all, I would like to thank the organizing committee, FPA Sri Lanka team. Today I'll be talking about the women's insights, the obstacles in cervical cancer screening, drawing experiences from Family Planning Association of India's initiative. This study has been conducted under the guidance of our program head and the CEO of the organization. Moving on to the introduction, cervical health is the crucial it is very crucial for the overall well-being of a woman, and which is neglected at most of the times. And cervical cancer is one of the leading cause of cancer-related deaths among women, and early detection will prevent 70 to 80% of cervical cancer cases. But though it is diagnosed at the last stage, most of these cases are diagnosed at the stage 3 or 4. Cervical cancer is the fourth most common cancer in worldwide, but in India it is the second common cancer next to breast cancer. And when we look at the WHO strategy 90-70-90, the 70% of the women will be vaccinated, will be screened by 2030. And when we look at the latest data, National Family Health Survey 2019 to 21, only 1.2% of the women were screened, but which is very high in other some of the BRIC countries, and US. In US and UK it is about more than 70%, and in Russia it is about 93%. But in India it is very low, 1.2% only. So it is significantly low in India. That's why the objective of this study is to explore the factors which deter women from undergoing cervical cancer screening in the operational areas of FPI India. We have taken survey statistics in 2023 from the FPI clinics. So Family Planning Association of India is a member association of IPPF and operates 45 branches and projects. And we initiated cervical cancer screening in 2013. And in 2023, we have provided more than 20,000 cervical cancer screening to the marginalized and underserved communities. So this is a qualitative study, and we have taken in-depth interviews from counselor, program staff and outreach staff. So we have interviewed our FPI staff who are part of the implementing the program, and thematic analysis was carried out. Coming to the profile of the clients, it is actually the women in the age group 30 to 50 years, they were screened, and the high-risk cases, based on the history, they were screened. So our data indicates that while talking to while we conduct the awareness session in the community, and it is our experience that 40 to 50% of the women, after attending the awareness session, they attend the cervical cancer screening session. About 1 to 2%, Then once they conduct they attend the awareness session, they are given pre-test counseling, then they are go for the screening. So on the table, about 1 to 2% of clients refuse to undergo cervical cancer test. And there are limited understanding among women about the importance of cervical cancer screening, and there are myths and misconceptions associated with it. So some women said it is a hereditary, and there is a belief that it is cervical cancer screening. The cervical cancer is a hereditary problem, and screening is needed if in case of multiple partners. And some believe that cervical cancer screening is very painful process, and some believe that it is not required because they are not committed any sin. And there is also belief that cervical cancer causes infertility, and screening, cervical cancer screening is very expensive thing. So this is the belief. There is stigma associated with the word cancer. So when they hear the word cancer, they don't want to, they feel something, and they don't want to go the cervical cancer screening. There is shyness and anxiety about the gynecological exam, fear of pain, discomfort, concerns, last minute anxiety on the table. So that's why 1 to 2% it is stated that they just refuse to undergo cervical cancer screening. And most of the women, most of our staff explained that fear about consequences of positive result, and family communities response, treatment options, and affordability are the major concerns among women for not undergoing cervical cancer screening. And also access to tertiary care and transportation issues, privacy and confidentiality in outreach settings, that is also mentioned by few of our staff, and resistance from male family members. So, because the religious and cultural things, and men are not cooperative in allowing the female members in their household to undergo cervical cancer screening. Also, when we are using AI-enabled devices, there is a fear that because it takes visual images, it may be leaked in the social media. That is also some concern. There are some reflections from the staff which I want to read out. One of the outreach staff mentioned, women come if they have some symptoms, very few turn up for preventive health care. So that is not their importance unless they have some symptoms. And one of the program staff mentioned that include cervical cancer screening as a routine checkup for women, visiting the facility for gynecological services while avoiding the use of word cancer. And the suggestion is to integrate cervical cancer screening in the gynecological services, because many times manual pelvic examination, so it can be done along during that process. And one of the counselor mentioned cancer word make them panic. When we say that it is sexually transmitted, they don't want to get tested as they feel that their sexual relationship gets suspected. And another service provider shared that women find reasons for refusing cervical cancer screening by telling that they are menstruating, because that time we cannot do the cervical cancer screening. And giving complete awareness is also a challenge. This was also mentioned. If a woman screened positive, she avoid the pap test due to financial difficulties. So going for additional confirmatory test and further treatment is also an issue because of the financial difficulties. So in conclusion, there is lack of awareness, cultural beliefs, accessibility issues, stigma, family support, which discourage women for undergoing cervical cancer screening. And also, if there is having a male service provider is another concern among women to undergo the cervical cancer screening. Fear of consequences, this is stated by almost everyone. Fear of consequences in case of positive results. Dependency on family members for healthcare decisions, that is another concern. So, incorporating all these findings, we try to incorporate these findings in the make a programmatic decisions, and we started giving the awareness program followed with individual counselings to improve uptake of cervical cancer screening. Also involving the beneficiaries to share their experiences about how was their feeling and what was their experience in undergoing cervical cancer screening. So that was one thing which we have taken up. And also integrating cervical cancer screening in regular checkup. These were the conclusions, and coming to the recommendations. So multifaceted approach that addresses cultural, economic and systemic barriers, it is needed to address cervical cancer, low participation and community engagement in collaboration with community leaders, local NGOs and healthcare workers is needed. Effective use of social media, strengthen dialogue among peers to encourage to undergo cervical cancer screening, and also male participation, male involvement that is needed. Establish referral linkages for further management at affordable cost, and educating younger generations about the importance of screening and getting cervical cancer screening done by near and dear ones. And in young girls and boys about the importance of vaccination at the young stage so that they can motivate others, their family members to undergo cervical cancer screening.